Establishing that biomarkers were predictive for outcomes in acute graft-versus-host disease at single time points was a major finding for us, and that they provided better predictions than clinical responses at the same time points was also very important. But we also wanted to investigate whether the biomarkers change over the first month of treatment so that they could be used to establish who was likely to respond to therapy, and would these be biomarkers of response. So we evaluated the same patients at weekly time points during the first month of therapy to see whether the biomarkers changed. What we found was that patients who lived tended to either have low biomarkers at the start of treatment and stay low, or start out with high biomarkers and have reductions over the first month of therapy. And conversely, patients who tended to do worse were those who had either increases in their biomarkers or who stayed high at all time points. And as a predictive benchmark, we found that a single threshold was able to separate patients, such that if they started out above it and went below, they had a significant reduction in mortality. And if they start below that threshold and went above it, that was also a signal of increased mortality. Looking at single time points is helpful to predict long-term outcomes, but GVHD is a dynamic process, and treatment decisions have to be made throughout the course of treatment. So what we hope is that repeated measurements of biomarkers will help clinicians make decisions about whether to change therapy. If someone starts out high risk but becomes low risk, perhaps they would be candidates for less intensive immunosuppression. And similarly, patients who start out low risk but become high risk may be candidates for additional therapy.